The coronavirus pandemic and its resulting economic hardships have negatively impacted a lot of Americans' mental health this year. The nation's top infectious disease expert, Dr. Anthony Fauci, says if the rollout of vaccines continues smoothly, we may achieve widespread population immunity by the end of next summer. With hope on the horizon, is there too much pressure on 2021 to be a redemption year? Clinical psychologist Dr. Wendy Dickinson joins me now to discuss this. Boy, Wendy, this is a really important issue, and I'm so glad to have you here with us today as we tackle it, because as we head into this new year, there is a lot of pressure on, of course, 2021, but people who feel like, you know, it's going to be different this year. So how do you manage those expectations?
Well, I think it's really important to pay attention to what we're focused on. You know, people have been through so much this year. There have been high levels of depression and anxiety. And I think that, you know, there's this idea that the clock strikes midnight and a magic wand is waved and 2021 is going to be amazing. And I think it's really important to remember that recovery is a process. We've been through so much. It's important to pay attention to how that recovery process works. And that's going to take some time. You know, in handling all of these stressors, it takes a toll on our physical health, on our emotional health. And so we need to do some things that help set us up for success in 2021. All
right. So what are some of the things specifically that you think we need to do to really set ourselves up for success?
Well, I'd go back to the basics. Think about how you're sleeping, what are you eating, what your goals are. It's easy during this time of stress to kind of let all of our goals slip away. And one of the things I've been talking to my clients about is paying attention to what worked in 2020 for you. There's some strategies that we all called on to be able to get through 2020, and those aren't the same for everyone, but things that work for you. Maybe it's going outside, exercising, creating some balance in your life, a routine. Going back to some of those basics is going to really be helpful, and then looking forward to what do you want to accomplish in 2021? What are you hopeful about, and how can you set some goals towards those things?
And so I guess what you're talking about in some ways with setting goals is a way of dealing with adversity, handling these setbacks. So what would you advise people, you know, if right out of the gate they get some sort of bad news? What would you advise them to do, to think about, that can keep them going in these difficult times?
I think one of the most important things, no matter what we're facing, is what we're telling ourselves. Are we telling ourselves that we are strong enough to deal with something? Are we telling ourselves that we're problem solvers and we're resilient? Or are we focused on the times when maybe things were harder than we thought we could handle? I think when we can tell ourselves that we're strong enough, then that's what we start to believe. And we become more likely to be able to face something hard and get through it.
Can I ask you something? And obviously you don't have to get too personal. I don't want to put you on the spot. But what have you learned about yourself in the last, I don't know, 8 to 10 months that you are now applying to your patients, or to the people that you talk to, the people that you consult with? But what have you learned about yourself?
I absolutely have learned that I can handle more than I think that I can, and I'm stronger than I thought that I was. You know, I think until you walk through the kinds of things that we have walked through, you don't know. You imagine that you can handle something, or you hope that you'd be able to handle something. But when you can look back and see, I gave it my best, I showed up, it wasn't easy, and I wasn't perfect, but I got through it. That's one of the things that I'm taking away with me from this year, is I can handle a lot more than I think that I could.
And when you talk to people who are dealing with so many of these issues, what is their number one concern that you're hearing over and over and over again?
Yeah, this year we have seen the rates of depression and anxiety go through the roof. And a lot of that is because of the isolation that people have experienced. I think one of the big things in 2021 is going to be people really having to work to get out of some of these ruts that we've all gotten into in 2020. We had to stay home in 2020 because of safety issues and distancing and recommendations. But in 2021, I think we're really going to have to revive those connections and relationships, really kind of give ourselves a push to get out of the house and go do something as soon as it's safe. I think that's going to help with that sense of connection, which ultimately helps to alleviate some of the depression and anxiety. The other thing I think is really important is that people assess whether or not getting some professional help would be helpful. We've seen the rates of depression rise, but we've also seen the rates of people reaching out for mental health care increase dramatically this year. And I think that's such a good sign to see that people recognize they can get help and that they're not alone if they need it.
That really is a good sign and a good place to end this conversation as we all collectively look ahead. We're all crossing our fingers and toes and whatever else you can cross, hoping that 2021 is a much better year. And with your advice, hopefully it will be. Dr. Wendy, thank you very much. Happy New Year to you.
You too. Thanks for having me.